Travis Yates is with us from the Health Center, and he's going to provide some information about opportunities and things students should be aware of and things you can communicate to them in your classes. So thanks for being here, Dr. Yates. Appreciate it.
And you need me to use this microphone? We don't need that. I want to give out a brochure about student health, and if I could just pass those around, and I'll collect any unused ones because I'm going to come back Wednesday and do the same thing, and I'm running low on my supply of those. But anyway, thank you, Dewey and Patrick. I appreciate the opportunity to be here. But my purpose of being here is just to tell you a little bit about student health and what we do there. And I guess probably the better thing to do would be for it just simply to be a question and answer type thing. But our little brochure that we had printed up tells a lot about student health, and it speaks for itself, and you should just take that as a guideline. But that's very, it's pretty superficial. I would presume everybody here is either a graduate student or an employee, so everybody should know about employee health. Employee health is on the second floor of our building at D.B. Harrison Student Health Center on Rebel Drive. 400 Rebel Drive is just at the top of the hill, and I would hope everybody in here knows where that is. I have employee health upstairs, student health downstairs. We're in the same building, but with two entirely different practices, if you will. The building is different. Downstairs, student health, it's all on Bursar. We don't take credit cards. We take cash, checks, but otherwise, you could come to student health without a penny in your pocket, and the charges go to the Bursar. So a lot of times people have questions about money, and do they have to pay when they come, and that is not the case. A lot of people at these orientation sessions, I'm asked often, what do y'all do at student health? What kind of problems do you handle? One of my recent sessions, I was asked, do we have doctors? If we even have doctors there. I guess they're accustomed to some student health centers which are manned by nurses and that type. They're more of a first aid type thing. We have 5 practitioners that are there, well, 4 and myself, and that is for the primary care part of it. My next question is, well, what is primary care? What does that mean? That is routine medical illnesses that any of us as adults would have, and that you would walk into like an urgent care center or a doctor's office for. That would include sore throats, that would cough, nausea, vomiting, diarrhea, simple sprains, abrasions, simple lacerations. I was in the ER for 17 years. We take care of lacerations and that type of thing. Now, if somebody got their leg ripped off, we certainly wouldn't take care of that. That has to go to the hospital, to the emergency department. So we do limit our scope of care to a primary care practice. We don't try to manage diabetes or hypertension, but we see those people, and I'll certainly refill prescriptions for their medications if they just simply cannot get back into their physician and that type of thing. But again, just routine adult care issues that you would go to the doctor for. We also, I'm fortunate to have 2 women practitioners. We have Ms. Becky Thompson, who is a nurse practitioner, and her certification is in women's health. We have Dr. Susan Gunn, who's internal medicine certified. The 2 women do the large part of our women's health practice. I used to do a good bit of that, but since we have our women practitioners, most of the young ladies, just from the comments, they would prefer and be more comfortable having a lady doing their exam, and we can offer that to them. And it's always their choice as to what we're there to serve them and make them as comfortable as we can be. Women's health would include we do a lot of oral contraceptive management. We do lots of STD screens, STD treatment, pelvic pain, urinary tract infections, and that type of thing. Countering that, we do a lot of male issues also, same thing. Guys are usually, it's just they don't take the birth control pills, so there's mostly STD screens and treatment and that type of thing. We have lots of STDs on campus, but that's anywhere you go. I would think we had not a bit more than any other college campus. I would think we would be comparable to other universities. Other things that we do, we give allergy shots to students if they bring their own. We do not do allergy testing. There are people in town that we can refer a student to for allergy testing, but we do not do that. But if you've been to the immunologist and you have your allergy medicine with a simple signature on a form that most every allergist would demand, I can sign that form, send it back and assure them that we can take care of a reaction to an allergy injection, then they will send that immunotherapy to our clinic, and we can give the students their allergy shots and that type of thing. We do all immunizations. As you know, Mississippi law, there are only 2. MMR is the only required immunization to attend a college in Mississippi. There has to be 2. There's criteria there. Those are mandates. You have to have that to come here. But beyond that, there are no immunization requirements to come to Ole Miss. Now, we recommend a ton of them. We recommend a flu shot every year. We do varicella. We do meningitis. Meningitis is big. All the parents want to know about meningitis. And certainly we recommend those highly. It's just very common sense that we would do that. So that's another big facet of things that we do. We have people come in with toothaches. Well, you know, we don't have a dentist. We do not have a dental practice there at all. So, but we can certainly, if a student has an infected tooth or something or having pain, we'll certainly get them some antibiotics and some pain medicine or some simple pain medicine to try to get them through until they can get to appropriate dental care. We do not, for the most part, without too very much exception, we don't deal in narcotics. The opioid, right now the opioid crisis in this country is just devastating a lot of young folks, and there's addiction and all the problems that go along with that, not to count literal deaths from opioid overdoses and stuff. And so, you know, we're very sensitive to that, and we're fortunate in that our demographic is usually healthy 18 to 22-year-old students, 23 maybe, and we just don't have to even go there very often. It's pretty uncommon that we would even have a request for a narcotic pain pill. If somebody breaks their ankle, certainly I'm going to give them 10 pills until they can get that fracture taken care of in an appropriate setting. But for the most part, we don't do that. Likewise, we do not deal in benzodiazepines. That's the class of drugs for anxiety, like Xanax. Xanax is a good drug for a specified purpose, but it's gotten a bad rap because we have so many of our young whippersnapper freshman students that want to get the Xanax, and they'll pay $20 for a prescription, and then they'll go sell every pill for $10 in the bottle, and so they want to make the money, and then it's all the abuse. Again, it plays into sexual assault and that culture that we fight so hard every day here. So that's the thing. Talking about sexual assault, we do offer sexual assault exams at Student Health. Ms. Becky Thompson does that. I can do that. I did plenty of those in the emergency department. Our volume of exams that we do, though, are not really high because we're open 8 to 5 Monday through Friday, and a lot of these things happen Friday night, Saturday night. But if a young lady presents, we can certainly take care of her and take a little pride in that. There's going to be a sexual assault training course here in Oxford, I think, that's usually in Jackson and on the coast and some places like that. But we've kind of politicked, and so there'll be opportunity for our nurses at the hospital and a couple of more nurses that out of my clinic that needs to go through that course, and that'll be in October, November. But anyway, that's kind of beyond what we're here for. Any type of skin, you know, rashes, bites, reactions, abscesses. We could do simple procedures like draining abscesses and that type of thing. That's more common. The MRSA, the methicillin-resistant staph, we have a good many abscesses in those things. We have sports medicine. Dr. Crowther is a heaven sent for us. He is about worked to death right now. He goes to the IPF to take care of the football players. But any athlete that right now is football, because he's getting hammered over there every day because they're practicing. And so he goes there every morning, but he's at our shop by 9, and he's with us from 9 until 5 every day, except for a Wednesday midday clinic that he goes over there and does. But so it's a big feather in our cap that we can offer sports medicine expertise to these intramural athletic people who get their sprains and the bum knees and that type of thing, any type of sports injury, we have that. And so if it's something beyond his scope, then he can refer it to orthopedics. Sometimes people ask me, what is sports medicine? Well, what does that mean? This is not an accurate definition, but my definition that people seem to be able to understand is a non-operative orthopedic person. He deals with all the sprains, knees, necks, backs, anything orthopedic he deals with. If it comes to needing surgery, they have to go to the orthopedist, who is a surgeon. And so it's a non-surgical orthopedic physician. And so that's the way I describe that people seemingly can understand. Let's see, going back to the STD screening, we do a lot of HIV screening that we recommend often. And we have, it gets confusing. If you come in and want an HIV screen on any day of the week, I have to draw that, and there's a $30 or $35 charge, I forget which it is, because I have to send that test to LabCorp, they charge me, and I have to recoup the funds for that, just like a CBC or any other test. But we do have a grant from the State Department of Health that is in place until this December, and I hope that that will be renewed. But with all the cuts in funding, the shortfalls in funding that we hear about, I don't know, I certainly hope it gets renewed. That grant allows us to do free HIV testing, but that has to be scheduled. I do not have the staff to be there 5 days a week. You know, we're already overextended, if you will, but I have a nurse that we call her at, we cut her nursing duties off, and so every Wednesday afternoon from 1 to 5, any student can schedule an HIV test, just an HIV for that afternoon, and they can come in and get that for free. And every time somebody asks me for an HIV test, I try to make it a point to tell them, well, I can get this test for free, but you got to schedule that. And surprisingly, a lot of people do not take advantage of that. They say, I just want you to do it right now. I don't want to come back. And so maybe if the demand increases, we can increase our hours and increase that offering. Because if we can give it to our students, we ought to be trying to do that. That would be our goal. We've had several discussions amongst our staff about LGBTQ care. And so it's a big focus in our clinic to be very sensitive to those needs. And we continue to try to learn about the specific needs of that community and make sure we're putting, outreaching to that community to make sure they are there. And if they have questions, if anybody ever has questions, I say, come talk to me. I can figure this out. And so we can see if we can make you, get what you need done here. So we're working hard on that. Another facet that I've not talked about is physical therapy. We have a physical therapy department that is just being moved from the state. It's over at Gillum now. They have just relocated to Gillum. The two Michaels, Michael Murray and Michael Brown, and they do a fantastic job, so we can offer physical therapy to our students if we need to. As far as insurance goes, payment, we will file anybody's insurance. We are in network only with Blue Cross Blue Shield of Mississippi, which is about half of our students. And sometimes I'll have parents say, well, I have United, you're not in network, so I'm going to send my child to the emergency department for anything they have going on. And I give them this example, and of course this may not always be the case. I said, be careful. If you're looking at the finances of that, just think about this. If you come to my clinic, as a student, there is no charge to see the physician. Now, there are charges. If I do a blood count, we do an ankle x-ray, I do a chest x-ray, we do a strep screen. Any of those tests, we do charge nominal fees for that. And nominal, I mean, it's like $30 or something like that. All the tests have different values. Chest x-ray would be $95 or something. But for just quick screening tests, we do those there. Flu testing, all of that we do. If you have a sore throat, we think you have strep, we do a strep screen, and so all you are charged, your bill at the end of that visit is $30 for that strep screen. And understand, if we didn't do any testing, that'd be $0 because we're supported by the university, so my salary is paid by this university. I'm not paid out of that student's fees, and that's a good thing. There's no emphasis for me to be doing a bunch of tests. I don't have that under the table pressure on me to do things like that. We are just free to do whatever we think is the appropriate thing to do. But so they walk out there for $30 plus their medicine. They do have to pay for their medicine. And that, I don't want to leave out the fact that we have in-house pharmacy. Sandy Bentley runs the pharmacy, she and Chad Westmoreland, and they have a full service pharmacy. It's just the same as if you go to CVS, Walgreens, or Walmart, Cheney's, whatever. Don't let me leave any of them out. but they can get most of their medicines right there. And if there's something that they don't have, she can have it by the next morning. So the students like to come to our place, and 95% of our students use our pharmacy because they walk around to the pharmacy to get their medicine, and they leave with medicine in hand. And so that is all good. But I got off track. The insurance thing, if they go to the hospital emergency room and they check them in and they get, say, $125 emergency room visit for the physician, they get some other service fee, they get $75 for that blood count. First thing you know, they're going to spend $300 for that student to be seen in the emergency department. And I don't have any clue what the actual numbers would be. I'm just throwing numbers out. But even if the insurance paid half of that, they're still $150 versus my $30. And so, I mean, and I'm sure it may not always work out. It may be a time that they should go to the ER from a financial standpoint. But we do pretty nominal care down there. And actually, I go to the ACHA meetings, American College Health Association. And in those circles, I mean, student health centers across our country are being looked at as one of the most efficient and economical ways to deliver care. And so they're looking at health centers like we have and trying to extrapolate that to the general public to maybe try to solve some of this horribly out of control healthcare spending that we have these days. And so, I don't know, I tell them, come on down and talk to us anytime. So anyway, but we are supported by the university, so some of that's probably not fair because we do have an income source that an independent clinic would not. I'm out of breath. What questions can I answer?
I wanted Travis to come today, and I appreciate him doing so because I have observed, as I've shared with him over the last 4 or 5 years, students kind of ignoring the resource that we have in the Student Health Center and going to these what I call dock in the boxes that have popped up all over town, these Red Med and all of these places. And they go and spend more money, and they go because their friend in the next room in the residence hall says, oh, I went there, or they'll, based on rumor, not on evidence, say, oh, it's too long a wait,
Yeah.
and I can't get seen at the health center. And I think it's important to us because we get the feedback coming because they come back and say, oh, I was out and I had to go to Red Med or trying to get an excused absence. I encourage you to make sure they have an awareness of of the resources we have here, quality care for almost no cost or very low cost, with very competent people. You know, the doc in the box is no disrespect for them, but you don't know who the hell's going to be in there taking care of you. You're going to just. Oh, my friend went here. So again, thank you.
That came from Dewey. That didn't come from me. Let me expound on that though. Can you be seen at Student Health, and what's the backlog? That is an issue, and that's a problem. And I could use at least one more, if not 2 more providers right now, but we are constrained by our physical facility. We only have 8 exam rooms, 4 doctor's offices, and so if I had another doctor walk in there today, I would hang him on a doornail. I don't know. We don't have any place for him. And the example is made is sometimes the nurses will put me, a patient, the doctors take care of patients in the hall rooms. Whenever they call me out, and I try to do administrative work in the morning, but I will go, we have a little closet that was converted to an exam room. I see them in there, and I see them in the procedure room in the back where we do lacerations and stuff. And the other doctors want their rooms. They don't want to go back to I'm happy to do that. And so when a nurse puts a patient for me in the regular hall rooms, all of a sudden, that doctor that should be in that room, he's back in his office waiting on me to get out of his way. So it's the same concept. If I had extra doctors there, somebody would be sitting there twiddling their thumbs because there's not a facility to do it unless I pull up a double wide out back. And of course, the university bought the hospital. And I don't know what will ever become of that, but it would be an easy stretch for me to think that maybe we could be moved off campus at some day in the future, but who knows about that? That's never been told to me by anybody from the higher ups. That's just a thought. But as far as being seen, we always welcome walk-ins. but we recommend appointments. If you can get yourself an appointment, then we try, if you have a 2 o'clock appointment, we try our best to get you back there within 5 or 10, or 2 o'clock on the nose if we can. We're invariably a little bit behind. If you call at 3 o'clock this afternoon wanting an appointment, I can assure you those appointments are going to be full, and your only option for that day would be to come walk in. Well, of course, we try to shut off the walk-ins at 4 o'clock because the halls are full, and it'll take it takes a little while to get everybody cleared out. But, we tell everybody to call for those appointments, and when people call, if we are full, they're offered to come as a walk-in, and they're also offered to make an appointment the next day if it's not that urgent. And so I wish we did have some more practitioners because we could certainly facilitate that. And one other very important thing that I need to tell you is our psych services. The counseling center sees a ton of folks with anxiety and depression, but they're counselors, they're not medical. And so if there's medicines to be involved, any anxiety medicines, antidepressants or anything like that, they have to come to us. I've kind of gotten known, whenever the counseling center sends somebody down, I end up seeing about half of them because our psychiatrist and our nurse practitioner, psych nurse practitioner, and they are in addition to our 5 providers downstairs. This is extra. And they are booked up right now too. I tried to get an appointment with Dr. Black for a student just on Friday, and I think it was about 2.5 weeks out before I can get that person in. But I take care of that in the meantime. I bridge that gap so that the student is not left out in the. Lots of parents ask about ADHD medicine, same as with the opioids and the benzos. ADHD medicines are, they're very. There's just an aftermarket for those. You go buy your Adderall and you pay $25 or whatever it costs for the prescription, and they can get I've heard $20 a pill, and it may be a lot more. I don't know. It's a big. You can make a bunch of money, and so the problem is these students. If you have a legitimate need for them, then it's a wonderful thing, and you need your medicine. But we've always got these sour grapes that spoil the whole basket because they want to go out there and do all this selling on the side and abuse them and that type of thing. And so, you really need to have a little bit of training to manage ADHD. It's not a simple matter. And so we recommend that any incoming freshmen stay in touch with their home provider. They can write their prescriptions like 3 to 6 months, 3 months at a time at least. Bring the prescription to us. Our pharmacy will hold those prescriptions and fill them on a monthly basis for it. But our providers downstairs, my folks, we do not manage ADHD. I mean, we only have the 2 psych providers, and we keep them backed up 2 or 3 weeks right now with the anxiety, depression. You get depressed and commit suicide, it's life and death. ADHD, hyper, attention deficit never killed anybody. So you may not make as good a grade, but it's not a life-threatening illness. And that needs to be managed, but that's one thing that again, if I had 2 more, I could use 2 more psych practitioners today. If we opened up an ADHD clinic, Lord, we'd have lines. It'd be a big thing. And we need to try to do that in the future, but that's just not today with the budget constraints that we have. So, yes, Sherry.
How much are you seeing of STDs in the clinic, and what all are you seeing? Because I think that's important information.
Let me tell you what we're seeing, okay? I don't know exactly. I get that question often, and I try to not answer it because any answer that I give you may not be correct, because what we see in our clinic may be a fraction of what's in all the rest of Oxford and the community. All of these students may not come to us. Number one by far is chlamydia. I mean, we see that weekly. I mean, probably daily. Then after that, there's a lot of herpes. Half of the United States population has been exposed to some herpes virus from a fever blister or genital herpes in the past. We see a lot of bacterial vaginitis, that type of thing that we can treat with some antibiotics. We fortunately do not see a lot of HIV, or if we have a lot of HIV, we are not seeing it in our clinic. So syphilis is fairly uncommon. HPV is very common. Of course, there's no cure for that. We strongly encourage the Gardasil vaccines to prevent the HPV infections in the female cervical HPV. That's the cause of 99% of the cervical cancers. And if we can get all these 12-year-old girls, you know, to get this HPV vaccine well before they become sexually active, then, you know, the hope and prediction for the future is that we can dramatically reduce cervical cancer down the road, you know, so. Anyway, and then I hear some parents say, oh, I don't want to have my daughter do that Gardasil. That might make her chances of sexual activity rise or something. I said, listen, we got to be talking about her health. You know, that young lady is going to become sexually active someday. That's nature. We all get there at some point. And we need to be thinking in a health-related fashion regarding that. So, anyway, chlamydia is the biggie. And then herpes, HPV, that's the big three.
Sir, we're going to have to wrap it up, but
I'm ready.
We do have a discussion board, so any questions that you may have that you want to follow up on with Dr. Yates, and I'm sure he'll be happy to talk to you in the future as well. So thanks for being here.
Just call me.